A hip replacement is, again, it's a resurfacing operation. It's resurfacing the worn out inside of the cup or acetabulum, but now replacing it in just the right position to optimize the mechanics. And it's replacing the ball, but what holds the ball in position is some sort of a stem or spike that comes down our upper thigh bone. And if you can perfectly position them and create just the right tensions on the muscles and the right offset, very wonderfully reproducibly, people do well. They do remarkably well. They just forget they've had their hip done. But most surgeons, certainly most hip surgeons, recognize still in this day and age the number one problem, the number one most difficult aspect of the operation to do consistently and optimally each and every time is getting the cup, the acetabular component, in just the right position and orientation. Even in this day and age, even with all the sophisticated and all the smart people trying to do this and get it right and all the goodwill, why is getting the cup still in this day and age by far still the most common problem? And it's because the tools that surgeons have had, quite honestly, haven't given them the information they need. Surgeons, people with goodwill have had to make certain assumptions before they implant the component, and the assumptions unfortunately aren't true. They have to assume they know where the pelvis is, but so often, invariably, the pelvis rolls a little bit or it moves a little bit. So my device, the pelvic alignment level, is something very intuitive. It's basically a bubble level which allows me to measure length and measure offset and know the position of the pelvis before and after and reposition it to known positions so that now we're eliminating assumptions. When I talk about the PAL, or when I talk about computer navigation, or when I talk about robotics, absolutely the benefit to the patient is more accurately and predictably getting the components, be it total hip components or total knee components or partial knee components, in just the right position and orientation to recreate their mechanics so that they regain their motion and they can hopefully have a normal life. Now, one of the benefits to the patient is this tremendous emphasis on being extremely gentle and meticulous with tissues. We talk about minimally invasive, and we talk about, you know, how to get well quicker, and there's a lot of emphasis on length of the incision, but the real emphasis should be on being absolutely meticulous with getting the components right so you're building a construct that hopefully will last for 20 or more years. So the beauty of what I do is we start with very, very simple technology in my PAL. We move into when I do total knees, when I use a computer navigation system that costs almost $500,000. And then when I do partial knees, and now I use a computer robotic system that costs almost $1 million. And I love this spread.